Okay, well, thank you so much, Dr. McGee, and hello, welcome to our presentation titled Prescription to Play, Adaptive Sports Experiences as Disability Health Education for Health Profession Students. So my name is Saumya Gupta. I use my name or any pronouns. I'm a South Asian person with short dark hair. I'm wearing glasses, over-the-ear headphones, and a black sweater. With a white flower on it. I am a research specialist with Student Disability Services on campus. And I'm also a PhD student studying health professions education at the University of Illinois, Chicago. And I will let Michael introduce himself.
Hello, everyone. My name is Michael Andres. I'm a first-year medical student at Temple University. I use he and him pronouns, and I am a white male with short brown hair, brown eyes, wearing a dress shirt.
All right. Since we unfortunately have to move pretty quickly to cover everything in time, I think India posted the link to the slides in the chat. There's a lot of text on each slide, so we won't have time to describe each slide, but please feel free to look through as we go through. So first, for the background, we'll talk about what adaptive sports are, and then talk about two conceptual frameworks that inform the study, and then describe what prescription to play is. So adaptive sports are sports with modified rules and equipment so that people with and without disabilities can participate. Adaptive sports has been shown to improve well-being and health outcomes for people with disabilities. And also this year, there's been some preliminary evidence showing that adaptive sports exposure has improved pediatric orthopedic surgeon comfort in treating patients with disabilities. The slide shows two photos of a more well-known adaptive sport, wheelchair basketball, and this is our very own Wolverine Invitational, which took place this year. And as many folks in the audience know, for the first conceptual framework that I want to introduce, in June 2019, there was a document released called the Core Competencies on Disability for Healthcare Education. This slide shows the title page of the document as well as 6 competencies covered. There's also 49 sub-competencies. I won't go over the details now, but this will be part of our discussion today. And then the final concept to introduce is called social prescribing, which is the idea that health professionals can prescribe community-based engagement to their patients to address multiple aspects of well-being. So the slide shows an image of two people, a provider offering different options like a financial workshop or an exercise class or an art class to a patient. And so, what Prescription to Play is a program that combines all of these and works to bridge disability in healthcare communities using adaptive sports participation. So, the slide shows all three: adaptive sports, core competencies on disability, and social prescribing, leading to what forms Prescription to Play. And so the primary research question we started with was, what reflections about adaptive sports and disability do health professions students have after adaptive sports participation? And as we used a constructivist grounded theory approach, this question has evolved throughout the process of qualitative coding. So another question that we have is, what are the learning outcomes associated with adaptive sports participation among health profession students? And finally, what core competencies on disability are addressed through adaptive sports participation during health professions education? I will say right now, we won't be able to fully explore these questions in this time that we have, but we want to just set the stage for future exploration. And so I'll go over the methods very quickly. So first, we hosted 9 different adaptive sports events. These are clinics where we have part of our members of our team and student athletes teach community members how to play a specific adaptive sport. So the image on the screen shows not an event from Prescription to Play specifically, but a wheelchair basketball clinic that we hosted at the Chrysler Center. Before Prescription to Play specifically, there were 93 recorded event attendees, and of those, we completed 21 follow-up interviews, and 11 of them were health profession students, which is what we will be talking about today. And so we conducted semi-structured interviews. Those topics included experiences in health professions education, experiences in healthcare if the student identified as disabled themselves, and experiences in prescription to play and in adaptive sports overall. I can talk a little bit more about the coding and thematic analysis processes that we used for this, but I really want to make sure that everyone gets a chance to listen to the results. So on to Michael.
All right, so after reviewing these interviews, we determined there were 3 major themes. One was that participants had an increased awareness and knowledge of adaptive sports. A second theme was that participants demonstrated an increased understanding of the experiences of people with disabilities. And our third theme is that participants had an increased desire to be involved in adaptive sports going forward. So before jumping into some of our quotes that reflect each of these themes, I just want to make a quick like formatting note. So we use several abbreviations on the slides listed under the quotes. So when you see HCT, that is referring to a healthcare trainee. PWD is referring to a person with a physical disability. And if you combine the two, so having an HCT-PWD, that's referring to a healthcare trainee who has a physical disability. So on to our first theme, where our participants demonstrated an increased awareness and knowledge of adaptive sports. We have three sub-themes and quotes that represent each of those. So participants who went through these events were really amazed by the wide variety of adaptive sports. This particular interviewee first learned that adaptive sports exist, which is a good thing, and also that there's a large variety of adaptive sports. So this person learned about that there's adaptive tennis, adaptive basketball, rugby, and track and field, and even others that they are potentially aware of as well. Additionally, our interviewees reflected on the difference between the recreational and competitive adaptive sports, specifically that a lot of our interviewees didn't really know how organized of a sport, like wheelchair basketball was, for instance, as this interviewee was, that they didn't realize that there were all these fully fledged teams that compete all over the state and all over the world. So seeing that there's both recreational opportunities to getting involved in your local community, and also national or international competitions that are very organized and integrated as well. And additionally, so our interviewees demonstrated an increased knowledge of the well-being benefits of adaptive sports participation. Um, One, yes, as in physical health of the exercise that adaptive sports provide, but also the mental and emotional health benefits, like working in a team-based setting. There's a lot of camaraderie and companionship that comes with being on a team, and this person reflected that on that in this quote. Additionally, this person also recognized, when you're playing in these adaptive sports events, it's people who don't have physical disabilities, people with physical disabilities, all playing together and having a common bonding experience, which was a really unique observation. So moving on to our second theme, our participants demonstrated an increased understanding of the experiences of people with disabilities. So first, in regards to aspects of daily living, initially, some of our interviewees initially thought of mobility devices as limiting, but when this person and their friends had the opportunity to be in a mobility device, such as a wheelchair, they actually see that it's the opposite and actually allows you to do so much more stuff, as this person indicates. Additionally, our interviewees reflected on their changes to approach physical activity, more in terms of how they view physical activity for people with disabilities. So this person reflected on some of the changes in their approach, saying that maybe they were a little limited initially in what they thought of as physical activity for people with disabilities, understanding that maybe some individuals may not be able to get 10,000 steps a day, but there's other ways that they can be active and have community. And that's something that's really important not to disregard, especially for patients who have physical disabilities. Additionally, our interviews reflected on their own personal biases. So this interviewee mentioned that they were not aware of the different levels of physical fitness and the different recommendations that were out there for people with disabilities. It's something and this person admitted that it's something that never really crossed their mind. So now they're aware of this, and they, will be thinking about that going forward. So moving on to our third and last major theme is the increased desire to be involved in adaptive sports. So our some of our interviewees had a good time at our events. They would love to continue going to the adaptive sports events while they were still at this particular state. And they also were demonstrating interest, as this person did, in getting active in a more medical role. So attending an adaptive sports event and being part of the medical team, work at the medical tent, they found that those things were something that would help out in clinical practice, as something that would translate to their own personal clinical practice, which actually continues into our next sub-theme, which is that some of our participants demonstrated an increased interest in integrating adaptive sports with their own personal clinical practice. So this interviewee mentioned that they're specifically looking for residency programs that have some aspect of disability health and adaptive sports. For example, looking for programs that have an adaptive sports medicine program, or institutions that are going in that direction and trying to have a commitment to disability healthcare in general. Participants also mentioned just an increased understanding in their own healthcare practice about how they can interact with patients with disabilities and also discuss physical activity. This interviewee mentioned that they have an increased awareness about attitudes towards physical activity for individuals with disabilities, but also in discussing physical activity and exercise in the context of physical and mental well-being with their patients. That's something that they reflected on should be prioritized going forward in their own personal clinical practice.
All right, thank you, Michael. This is Saumya speaking. So for the discussion, I really want to talk about some of how these quotes relate to relevant core competencies on disability. Um, and I just to say stay within time, I'm only going to cover three of them, but we did find connections with all six core competencies on disability. And then finally, I will wrap up by mentioning some of the next steps. So within professionalism and patient-centered care, 2.1, the subcompetency 2.1 mentions explore and mitigate one's own implicit biases and avoid making assumptions about a person's abilities or lack of abilities and lifestyle. So this subcompetency aligns with subtheme 2C, which Michael talked about, reflecting on biases. And then another competency was teams and systems-based practice. Specifically, I'll look at subcompetency 4.5, which says list systems of community-based services and supports that may be useful for patients with disabilities outside of the clinical care system. Be prepared to consider cultural factors, interact with these systems to make relevant referrals, to ensure comprehensive care coordination, particularly during times of transition. And so this is really demonstrated when participants talked about incorporating adaptive sports into their recommendations as a provider. Even just being aware of ASF as a community resource was important to us. And I briefly mentioned in the intro that adaptive sports has shown a lot of benefits for people with disabilities, but that includes not just physical well-being, but also the benefit of finding community. And then the final competency I'll talk about today is clinical care over the lifespan and during transitions. So this subcompetency 6.2 says integrate assessment information from individuals with disabilities, multiple disciplines, and ancillary informants in order to develop a collaborative healthcare plan that includes health promotion strategies and preventative care. And I really feel like that this subcompetency goes with the spirit of social prescribing. And so again, it's important that people are aware of ASF as a local community resource for maintaining physical and social well-being. And this is especially related to the last quote that Michael mentioned, where a healthcare trainee was reflecting on how they might ask a patient about their attitudes towards physical activity and incorporate that information while thinking about whether or not to refer them to adaptive sports. So overall, the findings from the study highlight the potential of adaptive sports participation to facilitate disability education in health professions fields. And this is really what we wanted to explore, is what were healthcare trainees getting out of this experience and how does that relate to what we in the health professions education field want to teach about disability. And this is an exploration we'll explore in future analysis of these interviews and in future studies. But really what I wanted to emphasize in this final point is that you don't need to completely change a curriculum to incorporate adaptive sports. And this is really important for people to know nationally because we always have this fight for real estate within the health professions curriculum. But this was an opportunity that happened because of a partnership with a local adaptive sports organization. And these type of adaptive sports organizations exist across the country and across the world. So since there is a minute, since we did start a bit early, I will say that our next steps are to examine some of the other interviews, which were with the participants who had disabilities to understand what they had gotten out of the program. And then finally, we'll explore sort of the gaps that these trainees had described in their current curriculum and how these learning outcomes might help fill those gaps. Here are our references and also some acknowledgments beyond the presenters themselves. We really want to thank the interviewees for taking time out of their day, especially because they're healthcare students, to help us understand this a little bit better. And finally, there's a QR code on the left of the screen to sign up for the ASF newsletter to learn about events, and a QR code on the right side of the screen to be added to the clinical coverage list for future ASF marquee events. If you have any questions, feel free to contact me. Thank you so much.